Okay, sorry about that. My recorder got cut off, but I'm almost done. I have like a couple more slides. Epidural hematoma, it occurs when a blood vessel ruptures between the outer surface of the dura mater, strongest of the meninges. The outer dense irregular connective tissue covering is composed of two layers, the meningeal layer and the periosteal layer. Blood leaks from and forms a mass that presses on the brain tissue, and epidural hematoma can become deadly without prompt treatment. And then intracerebral hematoma occurs when a blood pools in the brain, causes trauma, rupture of an aneurysm, vascular malformation, which is abnormal development in blood vessels, lymph vessels, veins, and arteries, high blood pressure, and a tumor. Some diseases can cause leakage of blood to the brain, like liver disease, brain tumor, drug abuse. Effects on the body, symptoms, um, increasing headache, vomiting, drowsiness, and progressive loss of consciousness, dizziness, confusion, unequal pupil sizes, slurred speech. Um, you might develop signs and symptoms of a hematoma right after a blow to the head, or it could take weeks to appear. When more blood starts to fill your brain or narrow space between your brain and skull, signs such as lethargy, seizures, and unconsciousness can occur. Important to see a doctor to catch it early so it doesn't lead to fatality. Diagnosis. So there's imaging techniques are the best way to determine the position and size of your hematoma. And those include CT scans. It's an X-ray machine to produce detailed images of your brain, most commonly used for intracranial hematomas. There's MRI scan. It's a large magnet and radio waves to make images take longer to perform and aren't as available for doctors to do this. An angiogram, if there's a concern about a bulge in a blood vessel, an aneurysm of the brain, an angiogram is used. It's an X-ray special dye to produce pictures of the blood flow in your vessels and in your brain. So treatments for hematomas. If hematomas are small enough, they don't need to be removed, such as like a concussion. You need to be watched for neurological changes. The best medical specialist to see is a neurologist. They have been trained in the diagnosis and treatment for nervous system disorders, brain, spinal cord, and nerves. Surgery is a treatment, and surgical drainage if blood is localized and isn't clotting. A neurologist would create a hole through your skull and use suction to remove the liquid. A craniotomy, which is a large hematomas might require a section of your skull to be opened and remove the blood. And these are my citations for you guys. And I'm sorry about that last 3 minutes that I couldn't get onto my first one, but I hope you guys enjoyed my presentation, and I thank you.